mute your microphone. Meeting materials were online and made available for downloading. This time, Secretary, please call the roll. And please indicate whether you're here in person or remote.
Representative Bowling.
Present from my NX office. Sorry about that.
You're muted.
Can you hear me now?
Still can't hear him.
I'll work on it. I'm present. NX office.
Representative Fleming. Representative Frazier Gordon. Representative Gibbons Prunty.
Here in the room.
Representative Sheldon. Representative Weber. Representative Westrom. Representative Wilner. Representative Petrie. Representative Reed. Representative Moser. Chair Bentley.
Okay. We've got members presenting in other committees. They're going to be coming back and forth, but we'll go ahead and get started. First, we have Commissioner Stroud, Ms. Dennis, Ms. Sammons from the Department of Community-Based Services to give us a presentation on the governor's budget recommendations. And just presenters, please identify yourself for the record, and you may proceed.
Good morning. I'm Marta Miranda Straub, and I'm the Commissioner for the Department of Community-Based Services.
Hi, I'm Misty Sammons. I'm the Director for the Division of Administration and Financial Management for Department of Community-Based Services.
And good morning. My name is Lisa Dennis, and I am the Deputy Commissioner for the department.
Are you ready for us?
We're having audio issues. We can't hear people on Zoom, so we have technical difficulties. Just bear with us, okay?
Oh, sure. Just let us know when you're ready.
I tell you, the Mr. Double you had was from Kim Moser. Well, she explained it real good. Somebody against you.
She did.
She did really well. My committee don't meet till 11. So stay right where you're at. Huh? No. You need the experience. Right, Mary? Yeah. Well, ma'am, your hair looks so nice. Thank you. And I don't say thank you. How's Rosemary? She's doing well. Yeah. Where's everybody? There's Mackenzie. That's all that matters. Anybody want water? I'll get you that. I'll get one. Mackenzie, you want some water?
Sorry, I've called multiple people. Someone's on the line. You couldn't hear anybody at all.
Couldn't hear Bowling when he said present via Zoom, and we can't hear them
And
speak.
you're not muted.
They're not muted.
Could they hear you? So like when
Yeah.
did they?
I just texted Sarah. She said I can hear everything so far, and Krista said she can hear.
Can somebody that is remotely please do a mic check for us?
This is Marta. Are you able to hear me?
I can, but I'm not sure.
Okay, bear with us. We still can't hear you. I could see your mouth moving, but I can't hear you.
Can you hear Representative Bowling?
Yes, I can hear you just fine. I guess
Okay.
they can't hear there in the committee room.
I see. Thank you, Representative.
Thank you all.
Can you all hear now, those that you're on Zoom? Can you speak and let us see if we can hear you?
Surely. This is Marta.
We can hear you. Okay.
Wonderful.
Representative
Wonderful.
Bowling,
Thank
are you still there? Okay, well, we'll move on. Go ahead. Proceed, Commissioner.
Again, let's try introductions again so that you all can hear everyone. Marta Miranda Straub, Commissioner for the Department of Community-Based Service.
Good morning. I'm Lisa Dennis, the Deputy Commissioner for the department.
Good morning, Misty Salmons. I'm the Division Director for the department.
You may proceed.
Okay, thank you. We'd like to thank all of you for your leadership and service and for this time to present our recommendations based on the governor's budget for our department. First of all, I want to let you all know, in case you're not aware of it, that we are the largest department within the Cabinet for Health and Families in terms of providing human resources. So we have a pretty dense PowerPoint with a lot of information. We're going to speak to it. However, we hope that you had time to review it and review it further after our presentation and bring any questions that you have for us. But we are big and we do a lot. So here's our mission for the Department of Community-Based Services. Our work is about reducing poverty, reducing adult and child maltreatment, and mitigating the effects of both, advance family and self-sufficiency, recovery and resiliency, and to assure all children are safe and have nurturing homes and communities, and to recruit and retain a workforce and partners that operate with integrity and transparency. Next slide, please. So these are the programs that we administer. As you can see, there are many. I'll highlight a couple. The Supplemental Nutrition Assistance Program called SNAP, which provides lunches and food for our kids and our families. We provide child protective services, foster care and adoption assistance. And we also have programs that are provide the Medicaid eligibility. We work with the domestic violence shelters and the sexual assault shelters, the rape crisis centers, and the child advocacy programs. All of these are key partners in helping us to work with vulnerable children, families, and adults. So all these programs are within the Department of Community-Based Services. We administer these. Next. So here we wanted to tell you who we serve, so that you have an understanding of our clients, our customers. So the total Kentucky population is $4.5 million. Kentucky families is about they're about 4.5 million people, not dollars. Kentucky families, we have 1.73 million, and we have 1 million children in the state. Kentuckians living in poverty are about 703,000. Household receiving SNAP, that receive our food assistance supplemental nutrition, are 244,000. Families receiving KTAP are a little bit over 10,000. Children in poverty, about 212,000 of our kids live in poverty. Children receiving KTAP are about 17,000, and children in out-of-home care are about 9,000. I want to point out that a new statistics for us, households receiving SNAP, which is a supplemental nutrition assistance, families on KTAP, and children in out-of-home care are all decreasing. We have made some clear interventions in assisting these programs to be able to not only create self-sufficiency, but keep kids out of residential care. And that number has been trending down for a while, especially the last 2 years. Next. The Department of Community-Based Service, this is who we serve. These are the recipients, so you can see how many folks we served under each of those programs. So we put the year 2019 and the year 2020, so that you can see the number of people that we serve within DCBS. Some of these are monthly recipients, so we have 531,776 SNAP beneficiaries average monthly. We then in TANF, we have about 31,384, and that's the average cash assistance for recipients. In adult services, we served over 10,000 folks. And in family-based services, which does investigations of abuse and neglect to children, we served over 50,000 children and in 2020, and 52,000 in 2019. Next. So here is some historical and budget expenditures that our director will go through the following slides. We get into the specifics of the budget. Misty?
So this is just a historical overview and the budgeted expenditures from 20 to 24. We'll present on the budgeted expenditures for 2022. So this year, our total budgeted dollars is 1.9 billion. As you can see, that number is a lot larger than fiscal year 21. And the majority of that is due to the federal dollars that we received through the American Rescue Plan, and also, the American Rescue Plan, and possibly some other COVID dollars are in there as well. Next slide. This just shows how our budget is presented by fund source. So 60% of our budget is federal funds, 28% is general funds, 11% is restricted funds, and 1% are tobacco dollars. Again, the federal funds is a lot higher than they typically run due to the funding that we received through all of the COVID dollars. Next slide. This is our budget by category for this year. 72% of the budget is for grants, loans, and benefits. Again, that's higher than normal because of the ARPA dollars we've received. Our personnel costs are at 25%, and our operating expenses are at 3%. And those are about the average that we normally have each year for those categories. Next slide. This breaks the budget down by program. The child care program is 29% of the budget this year. Again, that's directly related to the ARPA dollars that we've received for child care. Family and community-based services is 42% of the budget. Those are all the programs related to prevention services, kids in foster care and out-of-home care and adoption services. 22% of the budget is for family support. That's your SNAP benefits, kinship care, KTAP, medical eligibility, and state supplementation. And then 7% of the budget is energy. That's your light heat program. That is a little bit higher than normal this year, and that's due to also the COVID dollars that we received that allowed us to start the cooling program and also the water assistance program. Next slide.
So these are the departments for community-based service highlights of our recommendation in the budget. 23 million for fiscal year 23 and 24 to support a 10% increase for employees and social service workers classification that was effective December 16, 2021. As you know, DCBS, as well as the state and the country, has had challenges with retaining and being able to hire staff. And this is our attempt to be able to meet our mandate by being able to retain and hire staff by being somewhat competitive. So we need to maintain that increase to be able to retain the staff that we do have. 8.5 million in the budget and 27.2 in 24 to be able to have additional social workers. We have, as a result of multiple things, including COVID, including doing additional work, we really need about 350 social workers in child protective services so that we can reduce those caseloads. I know you watch those closely. We do as well. The average caseload really needs to be below 20, and we're nowhere near that. And we need to be able to hire enough staff to be able to give the quality and capacity that is needed to be able to do that hard work to make sure that families at risk and children in danger receive the services that we provide. About 19.6 to sustain and expand our prevention services, as we have made a drawn a line in the sand that we're not going to continue to operate in crisis. So we have invested with support from the legislature on prevention and how do we get upstream and begin to provide resources and referrals before folks end up in protection and permanency, and be able to assist them in getting the help they need before they end up in situations where there is maltreatment and abuse, etc. So we really need to maintain our prevention focus. We really appreciate the work that our partners, the Kentucky Coalition Against Domestic Violence does, as well as the Rape Crisis Centers and the Child Advocacy. They're key partners in dealing with family violence and child maltreatment and abuse and support. So we're asking for an increase of 34% for those three partners to continue to do the work with us. And as you know, everyone else is struggling with capacities for them to be able to pay accurate wages for their staff and be able to retain them to do their service. And $9.6 million to continue to increase child care assistance program reimbursement rate. You know how crucial child care is to our economy and to families as we move forward. Next. We appreciate your support and interest in our workforce, and we are committed to making workforce investment and are asking you to support our workforce investment. We have changed pay grades that were implemented by the governor in order to have different pay grades as folks come into our system to be able to attract people to come to work with us, not only to replace the folks that have left, but to add to the need that the agency has. We have entered a new hiring process to be able to quickly onboard new staff. It would take quite a while to get a new new applicant onboarded. That really contributed to the high caseloads and the delay in having staff. Now with this interim hiring process that we just implemented and were approved for, we're able to hire hire staff on an interim basis while our HR folks are able to do the administrative work, so that folks don't have to carry the caseloads for the folks that have left or retired for too long. Hopefully, we do already see this making somewhat of a difference. It's too early yet to tell you, but we're very excited about this. We have added a shift premium for those folks that are not working during regular work hours and being able to increase their pay to be able to answer the calls and be able to meet the needs that we have. We have instituted telecommuting and physical in-person hybrid work options. Just to remind everyone, during the pandemic, all of our staff saw children at risk and families who needed assistance on an emergency basis. But primarily that first year, we were a lot, like most, in a virtual place. As of June 11th of last year, we opened all of the public-facing offices and have folks in person in those offices. So we now have in-person and virtual as well. When we looked at our performance for the year that we were virtual, our performance improved. Some of the reasons for that is decreased absenteeism, lack of time to drive, et cetera, et cetera. So we're continuing to monitor that, but we love having the option of having both the in-person and the virtual to meet the needs of our clients, as well as to provide some work-life balance for these very difficult tasks that our staff has. We're working on cultural change that includes acknowledgement and remediation of secondary trauma within the workforce. All the literature tells us that it takes about 18 months for anybody doing this kind of very difficult traumatic work to get burned out or traumatized, and that impacts their capacity to do the work and also impacts their well-being and their ability to provide quality services to our families. We're improving customer service and on streamline for public programming assets to our programming as well, including our call center. And we have become more data informed and outcome driven with continuous quality improvement structure being put in place in order for us to continue to monitor on an ongoing basis what our quality work is. Continued successes next. We continue to expand our child welfare prevention services. We launched a statewide prevention collaborative with over 100 partners to provide in-community services to continue to de-escalate the amount of children that are in residential care and to intervene earlier on in the family or child crisis. We've implemented a qualified residential treatment program, QRTPs is what we're calling them, and we have begun various pilots. Some of these pilots have to do with both prevention and also addressing family recovery. We've implemented multiple electronic background checks and upgraded to streamline those. We have increased the child care assistance program rate, expanded eligibility, and created a transition period exiting the program to address the child care cliff. We have established a Kentucky Family Child Care Network to recruit and support family child care and small businesses, and that is really proving to be successful, and there's lots of interest in continuing to do that. We've issued the PEBT lunch assistance for our children, for eligible children who were closed during school. So as you know, for a lot of our kids, and so many of them live in poverty, the meal that they receive is at schools. When schools were closed, we were able to issue PEBT cards to all the schools that meet the criteria for PEBT, which is about 80% of the schools in Kentucky. We implemented a new federally funded water and wastewater utility arrears assistance program for those folks who had issues with their water bills. And we operated SNAP in multiple areas affected by the disaster. As you know, we responded in a very timely way to be able to provide those needed assistance that folks needed during the tornado and in Western Kentucky and the floods in Eastern Kentucky. Next. This is who we are, and we are willing to do any further clarifications or questions that you have.
Representative Bentley.
Thank you, Chair Lady. Commissioner, how do you coordinate with youth services on some of your services out in the field?
I am so sorry. I am not able to, I hear that you are speaking, but I'm not able to discern what you're actually saying. And I would like to respond to you. Is there a way to make your voice louder?
Yes, is that better?
Yes, thank you.
Okay. How do you coordinate with youth services out in the field? Because it looks like you would overlap in a few things.
How do we coordinate that? Yeah, we have senior regional administrators that work together to coordinate those services. There's very specific task and scope of work that the services have. And within that structure, there is a regional administrators, then we have directors and supervisors, and those meetings happen on an ongoing basis. I meet with all of the region directors. I have virtual meetings with frontline staff in all of the regions. So the coordination happens as part of the meetings and as part of the who manages what programs, whether it's family support or whether there's protection and permanency. So there is ongoing communication, meetings, virtual meetings, and leadership that ensure that our services do not overlap, that our services are being provided to the region and to the counties that we have staff for, and that we actually learn and keep our boundaries permeable, because some of the families we share. So we need to be able to address the family regardless of what program they come into.
Thank you, Commissioner. One more question,
You're
if
welcome.
I may.
Sure. Thank you, Representative.
After you spoke about children and out-of-home care, you were
Yes.
talking about the number of children, the numbers were reducing. Was that on foster care you were talking about?
No, those are children that are in residential treatment.
It's both.
So it includes those that are in with our partners in residential who have nonprofit residential treatments, as well as our foster care children.
Yeah.
So those are folks that are living out of home. So what that acronym is, and I'm learning those myself, Representative, is out of home care. So those children who are not placed with family, and we have continuously worked very hard and will continue to do so to diminish the number of kids that are out of home care, both in residential and in foster care. That is one of the major drives for our prevention work, so that it happens in the community. Those kids and families can get help in the community and do not have that reentry gap that happens when they leave a residential or a foster care. We're also working really hard to increase fictive kin and be able to place kids with families when those family members are available and possible, so those kids can stay connected to the family. So those has been some of the work that we've been doing for the last several years, and it's actually showing yearly that we continue to decrease those numbers, and we hope to bring lower numbers every year to you.
Yeah, that's great. Thank you for your time. Thank you, Chair Lady.
You're welcome. Thank you for your good questions.
Other members? Oh, Representative Westrom.
Thank you for being here today. I think you have one of the hardest jobs in state government. I have a couple questions about residential treatment programs. Can you tell me how many children are in placement at this time?
How many children, Representative Wilson, how many children?
How many children are in residential treatment programs? The private nonprofit.
Sure, not in foster care. The difference between
Right.
foster care and residential treatment
Right,
facilities.
higher level of care.
Okay, I do not have those numbers, but you all may.
It's around 600 kids.
600.
That continues to decline as well.
And
Okay.
how many facilities are open now? There used to be a lot of church-related facilities and private facilities. How many are open now?
We have about 40, I believe, partners that we are working with that provide the residential and also non-residential care. They also have really joined our prevention collaborative and are designing pilots and programs to provide more in-community services as opposed to having kids in residential. Because this is what happened, Representative Westerman, you probably know this, but what happens is that we were keeping kids way too long in residential, and then even if they did well in residential, when they got back to the community, they decreased their ability to function and retain all of that growth because they go back to the same issues that they left. So working in the community with the family, with the community agencies is really the way we want to go. And our residential partners are all part of this prevention collaborative to help create those programs. And we have several pilots across the state that are, we hope to show you some outcomes as a result of that.
Thank you. I would love to get a list of the programs that are now open, just for old time's sakes, to see who's still standing and who the newbies are. Thank you.
We'll be glad to send you that list, but all of our programs are providing residential care with actual physical capacity staff. Some of the issues that they have lifted to us is twofold. One, the ability to retain staff, to pay staff a wage that is competitive. So some of them, for example, Maryhurst had to close one of their cottages because they couldn't staff it. A couple of other folks are letting us know about that. Also, the financial strain of COVID on those residential partners has really impacted them. But as of now, we have, they're open and they're providing residential as well as parallel working with us to create more outpatient, wraparound, high quality community services. And we can send you the exact number of those. Unless, yeah, we don't know, but we don't know the specifics, but we will send you the exact number that is actually open.
Thank you so much.
We can provide you a list of our residential providers.
Yeah,
Yes.
we'll send you the list of our residential providers, and all of them are serving our children. They're just not, sometimes can't take as many as we need. We really do not want to go outside the state, but sometimes we're forced to do that. So we need to reinforce them and support them so they can continue to care, but also move out of residential into high quality community service. That's the vision.
Well, you took the words right out of my mouth. I wondered how many needed a higher level of care and went to a different state to get that quality.
Yeah. That's a very small number. We have some very hard to place youth that the local folks don't have the capacity to take on or the staffing to take on. They can't stay where they are. And I think we have, do you know the number that we have in out of state? Maybe.
Yeah, the number of children that are placed out of state for treatment purposes is around 10 or
10,
less.
yeah. I know it's under 12 last time I looked, but that's too many. We want them in the state, and we need to support our partners in the community to be able to keep them here, short-term in residential, and then follow-up work in the community.
Okay. Representative Bowling, do you have a question on Zoom? Okay. I have a few.
Thank you, though.
Okay. I have a few on. It's great news to hear that the numbers are going down because of the prevention services, but how can you guarantee that some of those decreases aren't because of COVID?
Because we started in 2019, before COVID. Actually, it was started before that, 2017.
October.
What is it?
2019.
Yeah, the actual emphasis started in 2019, and we started to see the decline. Then we continued to see it through COVID, but also the need hasn't shifted. The need is there. However, we have been more diligent, I think, and more intentional about working with our partners. So some of the kids have stayed a lot less time, not years like before. Mm-hmm. There's always going to be a small number of youth and children who are going to need to be in residential care. So I'm not denying that.
Well, I guess the reason I'm sorry to interrupt. The reason I'm asking is just, did some kids get missed because of, lack of being in the homes and in person and that sort of thing? It was my concern. So that's the reason for the question.
Representative, we agree with you. We've had that concern about the reporting of child abuse, as well as not having as many eyes like teachers and child care providers on our youth. So that's a real possibility. And we have been very concerned about that. But let me assure you that my staff has taken in all the complaints and all the requests for investigation, whether we were in the midst of COVID or not. So our continued work, as you can see, we've seen about 40,000 folks that meet criteria that we have seen and found resources and support for. Go ahead.
Sorry.
No.
And I would just add that, yes, in 2020, we did see a decrease in the number of referrals that we received within the department. But in 2021, that trend has returned to those pre-COVID numbers.
Okay.
As far as our reporting numbers have, not compared to 2019, we're seeing that trend become more back to those numbers. And also we have, at the same time, we have not seen the increase in children entering out of home care. So we do think that that indicates that our prevention services are having an impact. But like the commissioner said, we know that we've had those same conversations about how much is related to prevention versus some of the COVID impacts as well. But in 2021, we've seen our numbers trending again back towards pre-COVID numbers as far as reporting. And then at the same time, we did not see an increase in out-of-home care.
Okay, thank you. And then the pay grades, you're talking about on slide 11, you talked about pay grade changes implemented by the governor. I know that there have been issues in different departments. I know I had a transportation worker in my district with pay scales. It was a personnel cabinet issue. So I'm curious as to how the changes can be made just in your cabinet and not across all cabinets, because we've been told that the personnel cabinet needs to adjust all the pay scales for every state worker, every cabinet. So I just wondered how you can make changes over there and not everywhere else.
Right. Well, it's needed across all cabinets. So I agree with you. The state has really not been competitive in our salaries. So I understand that. We have had the capacity to change pay grades. Raises are given by the legislature, by the governor and the legislature. So we really have not done raises. What we've done is send to personnel pay grade recommendations. The governor approved those, and we were able to do that. I am not aware of who's doing that across the state, across the cabinet.
So with the pay grade changes that was implemented on December the 16th by the governor, that was to job classification. So that was across the board for everyone in those job classifications. So even individuals who work outside of DCBS that and other departments or other cabinets in those job classifications receive the same benefit.
Okay. And then on the virtual part, I kind of have a personal story that I just wanted to share. We have our youngest daughter is in the process of adopting a baby girl, and the baby was out of Lexington, out of Fayette County, and there were concerns about them truly knowing what kind of home she was put in. I mean, she's in a good home, but I mean, the fact that there was a lack of in-person, on-site eyeballs on their home and that sort of thing. There may be some conversations. I may be reaching out to you all to let my family share their experience, just for caution. You know what I'm saying? For the child.
Representative, we would love to hear from your family and talk about that. What we've done is actually what's happened as a result is children are able to show us and their family where they're sleeping and where they're eating and who their family is. So we've seen some positive connections with biological families who would not naturally get to see that when they visited with their kids. But it is always an ongoing assessment of what's working. There's lots of unintended consequences, as well as some that we never expected, like our performance and our absenteeism decreasing and our performance increasing because we took the stress and also giving people those options. But, we're all learning as we try virtual, and that is a real concern. And I would personally be glad to talk with your family and hear their concerns and look at that.
Okay. And then the last question, could you just expand a little bit on the the transition period, exiting the program for child care assistance to address the benefits cliff? Because I know we're going to hopefully look at public assistance reform
Sure.
this session.
Sure.
So what's that look like and how's it working?
Yeah, I would let our deputy commissioner respond to that.
So beginning in March, as individuals are no longer eligible for CCAP, they will have an opportunity to reduce the benefit cliff effect for 3 months, or receive payment assistance at 50% for those 3 months, and so that there is not an immediate loss of benefits.
Okay, so it hadn't started yet. You're getting ready to implement
March,
it.
yeah.
Okay.
It'd be
Okay.
March of this year will be
I think
implemented.
the exact date's March, like 3rd or 4th, but yes, March.
Great. Okay. Thank you very much. And thank you for your presentations. Anybody else before we move on? Thank you very much for your presentations.
Thank you for your time. Appreciate it.
Madam Chairwoman, while
Yeah.
we're changing presenters, may I register my attendance?
Yes. Yes. Did you get that? Yes. Okay. Next we have Commissioner Vino to provide a presentation on budget recommendations for the Department for Income Support. Please identify yourself for the record and you may proceed. Did you hear me, Commissioner Vino? Okay. Coming to the table. Commissioner Vino, are you there? Can y'all hear me? Y'all are muted.
I can hear you, Melinda.
Hey.
There you go. My apologies, Chairman.
Okay.
It's a story of my life. You're on mute.
Okay. Well, introduce yourself and proceed.
Yes, ma'am. My name is Steve Vino. I'm Commissioner for the Department for Income Support. I have with me my deputy.
Good morning. My name is Stacy Kane, and I'm the Deputy Commissioner for the Department of Income Support.
And off in the background, we have Lily Pattison, the Director of Child Support Enforcement. The Department for Income Support, who are we? Our mission is to ensure vital income supports are provided to enhance the well-being of families in Kentucky. Child Support Enforcement's mission to ensure Kentucky's children are financially supported by both parents. Disability Determination Services mission is to determine the medical eligibility for residents of the Commonwealth who apply for Social Security disability benefits and SSI. Next slide, please. Child Support Enforcement's accomplishments, they dispersed directly to families and children $347 million in federal fiscal year 21. And this program is 66% federally funded. They established paternity in nearly 92% of children born out of wedlock. They passed the federal data reliability audit and review, which requires 95% and above minimum score to pass. That's a review of our Kentucky Automated Support Enforcement System, Should we fall below 95%, that could subject the program to financial penalties as well as the cabinet as a whole. We updated the child support guidelines, the child support awards guidelines that had not been updated since 1990. With the great help of Chairman Ed Massey of the House Judiciary Committee, 404 updated the guidelines scale amounts to statistically valid information today based on Kentucky economic data. And this is both an accomplishment and challenge. We continue to work with our outdated child support system, the Kentucky Automated Support Enforcement System. It was rolled out in the early 90s, and it's based on COBOL programming. It's not a very efficient platform. There's not a lot of flexibility you have with changing times today. COBOL programming, for the most part, is no longer taught in colleges. And our programmers are retiring out. Next slide, please. Disability Determination Services accomplishments. The DDS in Kentucky was the only state to meet the workload goals asked of it by the Social Security Administration. They met the all initial reconsideration, continuing disability reviews, and total claims, which was it's the only state in Region 4. So that was a tremendous accomplishment under the circumstances. I failed to mention too, this program is 100% federally funded by the Social Security Administration through a spending plan. Also, on top of all of that, disability was able to transition to a new national processing system called the Disability Claims Processing System within 6 months. Social Security Administration required all states to move to this new platform. Many of them were given 2 to 3 years. Kentucky, we did it in 6 months with little disruption. And finally, we successfully completed a federal financial audit during the pandemic by the Social Security Administration, which is pretty remarkable. They do a deep dive within our financial management processes, and it required a lot of legwork by both our disability financial staff as well as cabinet staff. It was a all hands on deck process, and we did very well. Next slide, please. So the mandates for disability determination is determine medical eligibility for residents in Kentucky who apply for Social Security or SSI benefits based on their criteria. The Social Security Administration contracts with each state to do the determination process. Here in Kentucky in federal fiscal year 2020, we processed 72,149 claims in Kentucky. And we, in federal fiscal year 2022, a projected amount, but pretty close, we processed nearly 74,000 claims. Next slide, please. So some of the challenges in disability, hiring qualified candidates. So in disability, as well as in many agencies, we have a high turnover rate. Consequently, because we have a high turnover rate with staff, our caseloads are the highest they've been in a number of years. It's maintaining adequate staffing to do adjudicative disability claims is becoming increasingly difficult. and attempts to raise salaries to be competitive in the open market is increasingly difficult. So that's the major challenges for disability. Next slide, please. Budgetarily, what we're requesting in state fiscal year 22 is actually, I'm sorry, state fiscal year 23, 121,598,700. And in state fiscal year 24, we're requesting $121,507,500. Next slide, please. So this slide is a pie chart depicting the program's 22 expenditures, projected expenditures. So in disability, it's projected to spend $53.4 million, or 45% of the overall budget for the department. Child support occupies 55% of our total expenditures, or $64.2 million of the total department budget. Funded initiatives in the governor's recommended budget: employee cost of living adjustments, staffing needs to support administrative and a financial management division. The creation of a separate division will increase oversight, financial fidelity, efficiency, and proper development and adherence to consistent cabinet-wide policies. Cross-training, cross-assistance will be provided between branches within the division, and resulting in cost savings and preparedness for staffing attrition. And also included in our capital funds request is the phase 3 approach of our Kentucky Automated Support Enforcement System. So as I mentioned, it initially rolled out in 1993 statewide. We did in 2011 do some modernized tools, business intelligence, and the locate portal. So this phase 3 approach will take the statewide child support system off the outdated COBOL programming platform and move it to a new platform, which will be more modern, more flexible, will be web-based. And so that concludes my presentation. Are there any questions?
Any members have questions? No. Representative Bowling? Okay, I had a couple. You answered the first one. I was going to ask what the plan was on the COBOL system, but you answered that one. But I was just curious, it doesn't really have to do with the figures per se, but on slide 5, when you talk about the number of disability claims processed, how do those, they kind of, to me, they're all in about the same ballpark, 72,000, 70,000, and then you said you projected 73,000 or almost 74,000. How do those numbers stay so close the same? I mean, I'm a former physical therapist who work with people with disabilities. It's like, how do they stay about the same number every year? It's just kind of curious to me.
Well, I mean, our workload is based on what SSA assigns to us. And I think these numbers are pretty remarkable considering the turnover that we've had, and that we've able to even increase this past immediate federal fiscal year.
So they're assigned to you? They're not just based on people that become disabled?
Well, yes, they are, but they come through the Social Security Administration.
Okay. So, and I hear what you're saying. You're saying you have staffing issues, and so they've got a high caseload, and I get that part. I'm still just curious how the numbers kind of stay the same, but anyway, I just don't know that people are disabled at a regular rate. That's all.
I'll ask Deputy Commissioner Stacy Kane to respond. She oversees the disability program.
Thank you. As far as the numbers, when we have a spending plan that is, we do that in September each year for the new fiscal year. And the Social Security Administration, they look at what we've done the year prior, and then they assign each state, like we have our workload numbers and goals. And the reason they stay close is due to, a lot of it is due to like the continuing disability review claims, like the initial claims, which is when the person first applies for disability. It's getting lower, in the probably last 10 years, that is decreasing. But the continuing disability review claims, I think that kind of makes everything stay similar.
Okay, well that makes sense. That makes sense. Okay. That yeah. And if they're declining, that's good. Then people aren't getting disabled, so that's good. So
yes.
Okay. Well, thank you all for your presentation. It sounds like you've included a plan for addressing the problems that you stated. So we'll see how it works out. Thank you for being here today.
Okay.
Thank you.
Thank you. Good to see you again.
Good to see you. Again, I'll say to you all, but we're glad to see you back here in person.
Yeah. Yes, I would be happy to.
Thank you. Okay, and our last presentation will be from the Office of Health Data and Analytics by Eric Lowry. So Eric, just please come to the table and identify yourself when you're ready and proceed.
Excuse me. Yes, ma'am. Good morning.
Good morning.
My name is Eric Lowry. I am the Executive Director of the Office of Finance and Budget. And I would like to thank you all for inviting us today to speak on the recommended budget for the Office of Health Data and Analytics. The Office of Health Data and Analytics is currently a freestanding department within the cabinet that was created in 2018. After much evaluation, the cabinet feels that the current structure of the office could be better streamlined from where it is today. We are currently pursuing a cabinet reorganization under Senate Bill 133, sponsored by Senator Meredith, that would ultimately eliminate this office and move the functions into a couple of different areas within the general administration and program support budget. We feel like this will properly align services and operations. The goal of our reorganization bill is to put programs where programs need to be. So what will that look like? Two functions that are in the Office of Health Data and Analytics the telehealth services and the health information exchange will be moved under the Office of Inspector General. This will allow for healthcare providers that are regulated to all fall under one agency rather than falling under multiple agencies. We feel this will be beneficial to the provider community and the cabinet as well. The remaining functions of health data and analytics will be rolled into a new entity of Office of Analytics that will be placed directly under the Secretary's office. And this will operationally allow them to better serve the cabinet and all of our departments. Next slide, please. So you're familiar with this slide by now. This is a 5-year window of historical expenditures and then the recommended budget. As you can see, for fiscal years 23 and 24, the budget is a little over $44 million each year. Most of those dollars are restricted agency funds and federal funds, with a small amount of general fund dollars that are dedicated to the analytics function. So, like I said, with the reorganization bill, this department would be eliminated, but the functions would just be relocated in the cabinet to provide better operations. So this is the extent of my presentation. Before I open it up for questions, I would like to say thank you to the committee. Over the last month, having our cabinet in front of your committee to discuss our recommended budget and the programs we offer, the services we provide, the dollars that we're over, we would like to thank you for allowing us to provide that accountability and the explanations of what we do. So at this point, I would open it up and be glad to answer any questions you may have.
Representative Sheldon?
Yes. Am I understanding you, and appreciate the presentation, but am I understanding you to say that that you're in complete agreement with Senator Meredith, and that you feel like this is a good move to reorg your department and combine it? Sounds like it is.
Yes, we do feel that it is a good move to reorg and combine this. There are funding advantages as well as operational advantages to moving the analytics piece directly under the Secretary's office. And we do feel that moving the telehealth and health information exchange will have long-term benefits to the Inspector General's office and the provider community.
Thank you very much, and I would certainly encourage additional reorganization within the cabinet, looking for more efficiency. So I'm glad to see this, and thank you for that presentation.
Thank you.
Representative Bowling, do you have any questions? Okay. Representative Sheldon basically asked my question, but can you just briefly explain again? I understand putting the bulk of the analytics right under the Secretary, the telehealth and the other piece that's going under, what, can you briefly explain the separation of that again?
I have with me Deputy Secretary Banahan. Could you address the information exchange piece for?
Right, so Carrie Banahan, Deputy Secretary, Cabinet for Health and Family Services. So our Kentucky Health Information Exchange allows providers to access information. We have, I guess, hospitals, we have physician offices, we have primary care centers. It's all provider related. So with our Office Inspector General, they license providers, they run the CASPER program. So we thought that would be a good fit to put the Kentucky Health Information Exchange under them because it's provider specific.
Okay. Thank you for that clarification. And with no other questions, is there anything else? We don't have a quorum to do the minutes. We'll have to do that next time. We do not. Okay. We do not have a quorum to approve minutes from the last meeting. We'll do that the next meeting. But well, thank you very much for your presentation and your time today.
Thank you.
Thank you.